the health authorities have intensified public education, and what that is doing is that it is changing a lot of minds.
Healthcare workers in Ghana are desperately working to contain a deadly meningitis outbreak. The World Health Organization is aiding as the situation is reaching a critical mass. So, Ridwan, you are joining us from your home in Accra. Tell us what you're seeing.
Now the situation is under control, but a couple of weeks back it was quite dire because more people were dying. People were reporting late, so they get to the hospital very late, and then there is very little that the doctors can do. But now some new measures have been introduced. So, for instance, the government has made the treatment of meningitis free because initially cost was a factor. It prevented a lot of people from reporting on time. And also we had issues around misinformation and disinformation where people say that this is spiritual and it has nothing to do with, medicine. And so people spent a lot of time in prayer camps, in traditional healing, places, trying to get some divine intervention. But the health authorities have intensified public education, and what that is doing is that it is changing a lot of minds. So people are noticing the symptoms. So immediately they notice the symptoms, um, they report, to the hospital, and so cases are now being detected early. But there are systemic challenges that still need to be addressed, and those are the key talking points here in the country.
And why is it taking people so long to get to the hospital?
Because the first and foremost, the outbreak is happening in a region that is considered one of the poorest in the country. It's called the Upper West region. Poverty is very endemic. And so people are living in very deplorable settlements. Most of the roads there are in very deplorable states, which means that people have to go through a lot to be able to access health centers. The health centers are not accessible. And for instance, if somebody has an emergency and they need the ambulance to come and get them to the hospital, they would have to pay for fuel, for the ambulance before they are able to do that. And this is a region where majority of people live on less than $2 a day. How are they able to, afford fuel for ambulance? So a lot of them, once money becomes the issue, that they rather, I beg your pardon, they rather stay at home and look for other remedies. And so that is also the challenge. So it's the issue about poor road infrastructure, the issue about poverty, and the fact that healthcare is very expensive for a lot of people to afford.
Now, you mentioned that some people have been turning to spiritual practices to try to treat this disease. Tell me a little bit more about where that's coming from. Are people understanding that this is something, one that is a bodily illness that can be deadly, and two, are they resistant to any kind of treatment along with those spiritual practices?
The thing is that even though Ghana is a secular state, religion is very big in the country. And so, for instance, in Ghana, the three main religions are Christianity, Islam, and traditional African religion. And in the north, people are predominantly Christians and traditionalists. And so everything has a spiritual dimension. When people are having a disease that they can not wrap their heads around, then they tend to associate it with, with spirituality. And also remember that superstition is very rife in these parts of the country. And so whenever there is something mysterious happening, people are quick to say that, okay, this is what is going on. So it's deeply rooted in tradition, it's deeply rooted in traditional beliefs. And when it comes to issues of beliefs, it's very controversial and very sensitive. And so that is also making it very tough for the health promotion officers, for instance, to navigate in terms of how to communicate, you know, in terms of how to handle risk communication in the area, because people just wouldn't accept that, okay, this is medical, and so you don't need to go to the hospital. Sorry, you don't need to go to the prayer camps, rather go to the hospital and get care. So sometimes people meet the health officers with a lot of resistance. But like I indicated earlier, with a lot of education, people are beginning to reason. And what the health authorities are also doing is to get religious leaders to be at the forefront of these public education campaigns.
I know you mentioned that the healthcare system in Ghana is very expensive to access, but generally, is the healthcare system equipped to handle an outbreak of this sort?
Um, the thing about meningitis is that this is not the first time we are recording meningitis outbreak. It is an annual occurrence, particularly in the Upper West region. But what we are seeing this year is that the bacteria causing this very particular outbreak has um has developed a new strain. And so the previous strains, we had vaccines for it. So whenever there is an outbreak, the population is vaccinated. But with the current strain, we don't have vaccine for it. And so it is evading immunity. And so that's where the challenge is. Now, apart from the issue with the non-availability of vaccines, this outbreak also comes at a time that Ghana's economy is undergoing a lot of serious challenges. We are also seeing the foreign aid freeze with the Trump administration, which has greatly taken a toll on the health sector in the country. Then also, the country has poor infrastructure to deal with the situation. So, in terms of the knowledge, in terms of the technical know how, it is there because we have experience, managing COVID, we have experience managing malaria, we have experience managing other outbreaks. But in terms of the critical medical supply, in terms of what we need to do the health system strengthening, and also be able to conduct that critical research to be able to see whether existing vaccines could be updated to offer some protection to the residents, for instance, the resources are not available. And we are feeling the pinch because of the freeze by the aid freeze by the Trump administration. And already we get the indication from the Ghana Health Service that it is taking a huge toll on some projects that are supposed to happen and are supposed to, help strengthen the country's health system. But the government puts the gap left by the aid freeze at $156 million. So that's quite a colossal amount.
And that certainly hits home, considering so many people, not just from the US, but from the diaspora around the world, are returning to Ghana and settling there. So, given that, Ridwan, in terms of humanizing exactly what is going on, what's one thing you want people to know?
I mean, I think for the longest time, when it comes to disease outbreaks, we tend to throw the numbers, about and make it look like it's just numbers. But we are dealing with real human beings, people who have families, people who have livelihoods, and people who have died have dependents. So for me to be able to humanize the story is to create that sort of relatability and connection for the audiences to appreciate the gravity of the problem, and also to create a global resonance that you cannot say that because it is happening in Ghana, the rest of the world shouldn't be bothered about it. And so, for instance, in the case of HIV, you cannot say that you have ended HIV in the US when there's still HIV in a place like South Africa. And so, when there is meningitis in Ghana, people in the US should be concerned.
Well, thank you so much, Ridwan. It was a pleasure to speak with you, and we certainly hope that the situation there eases up.
The pleasure is mine.